Hi friends, Dr. Nancy Trimbley here, putting the power and knowledge of your health back in your hands. How do you know when you need an adjustment or when somebody in the family needs an adjustment and you're at home and you're just not quite sure? So I'm going to show you how to do a leg check at home. Now keep in mind, this is a skill that is developed by chiropractors that takes years to develop. So I'm going to simplify it a little bit. So let me know if it works for you. And remember, hit the subscribe button below. It is free and you will get notifications if you hit the notification bell of when we do new videos. So I have a subject here and this is my patient. And I also have a pillow because you're going to be doing this leg check at home on a bed more than likely. So you're going to be having the person lay with the pillow here below their chin face down. So, and this way their head can be level with their face forward. So go ahead and lay down face down for me with your chest here and your head there. And your arms can go down beside you. So now their spine is straight from their head down their spine and their legs are hanging off the table. This is important. So one of the things you can do is that you can look at the length of the legs and you'll have to see, now remember, a chiropractic leg check looks for leg length equality. Some people do have legs that are different lengths by maybe a millimeter up to an inch or two. This is actually rare. There is a fallacy that everybody has one leg shorter than the other. Not true. It does exist, but it is pretty rare. When somebody has one leg that's uneven and they should not, it is not normal for them, it will indicate that they have a subluxation somewhere in their spine. I mean, their hips are out of alignment, their neck is subluxated, there's a problem somewhere that's creating an imbalance from left to right. And one of the easiest imbalances for us to see is a change in the tone of the legs, the muscles of the legs, which will draw one leg up short. So you can look straight down at the shoes, and this is easier if somebody has shoes on that has a very definite welt of the shoe. The welt is the change between the fabric or leather portion of the shoe and the sole. That's the welt. So you're going to look straight down to see if there's a change in the leg length or a difference from left to right. Notice I have to touch the bottom of the shoes to level them out. So that's one thing you can do. Here's something else, and those of you that are patients see me do this at the office. Keeping this whole leg straight, and if the patient you're checking is a patient of mine, they'll know how to do this. They're going to lift one leg up straight, and you're going to compare this one then to the left. Notice how those are even. If you were to see one leg come up really high and the other leg not high at all, that's an indication that there's a lower back subluxation. If one leg swings way out to one side, it's kind of a little wild, and the other one either does the same thing or doesn't at all, again, that's another indication. So I hope that helps. Try it out. Let me know. As always, putting the power and knowledge of your health back in your hands. Bye for now.